www.healthcmi.com. Acupuncture, continuing education online. Today, let's take a look at acupuncture and herbs for rheumatoid arthritis. This comes from an article published at healthcmi.com on January 29, 2020, entitled Acupuncture and Herbs, Rheumatoid Arthritis Relief Confirmed. So go to healthcmi.com, click on news, and take a look at the article. So hospital researchers took a deep look into this. And what they found was that if you took acupuncture and herbs and added to more conventional drug therapy, the outcomes were significantly better. Now, the patient outcomes weren't just less pain reported by the patient, less swelling that could be measured, but also blood factors. So much better improvements in rheumatoid factor, C-reactive protein, and the erythrocyte sedimentation rate. So again, both subjective and objective factors improved by adding acupuncture and herbal medicine into the mix. Rheumatoid arthritis is very different than simple osteoarthritis, which is more of a wear and tear type of arthritis people are familiar with. Rheumatoid arthritis has to do with an inflammatory process inside the body. And this process can have devastating effects. It can lead to hot, swollen joints, crippling pain, and worse. So this is no small thing that we're getting these kinds of results. Again, this is a very serious study because what happened was they had two study groups. So one group had an anti-inflammatory drug and a chemotactic agent, so diclofenac and methotrexate. So that's group one over there. Now group two received the same drug therapy that someone would normally get. And that's heavy-duty stuff that they're administering. But they added the herbal formula Wen Shen Tong Bitang and warm needle acupuncture, which is acupuncture with moxibustion. And that's when the jump in improvements happened. Now, the article gets into a lot of details of the exact improvements that were made. It gets into a lot of numbers, what you can expect. Pretty good sample size. It was randomized and controlled. Clinical trial. It gives you the exact dosages that everyone was taking of the drugs. And they show you the herbs. So the herbal formula was Sangji Sheng, Dangui, Shudi Huang, Duzhang Guichi, Bai Shao, Zhimu, and Fuzi. They give you the exact dosages, preparation techniques, and then the acupuncture points. Now, this was very interesting. The warm needle acupuncture was a very simple set of points, which is typical for rheumatoid arthritis patients. So it's Xi'an, both eyes of the knee, so bilaterally, Liang Qu, which is stomach 34, Shui Hai, spleen 10, Yang Ling Chuan, GB 34, Yin Ling Chuan, spleen 9. And that's it. And they give you some of the details on how moxa was applied, how long, how many treatments were given. But what's interesting here, and it's very different than what people normally receive, is treatment was administered daily for 1 week. So that daily treatment became very important in this protocol to get the results. And the results are very promising. But what it does suggest is that people with rheumatoid arthritis are going to need rounds of concentrated care, and then they can take a break for a while. Because what happened was, after a round of intense care, at both the 12 and 18-month follow-up assessments, the acupuncture and herbs patients did way better than just drugs only. Now again, people got the drugs, they got the acupuncture for a small concentrated amount of time, and then they did a follow-up with no care after that, 12 months and 18 months later, and sure enough, results held up. So that's the key to the acupuncture and herbs, is it's really helping results not only to improve, but to last longer, which is important. People who are taking these kinds of drugs would like to take a lot less of them if possible. They'd also like to have less flare-ups, less intensity of pain, better ability to walk, to use the arms, to be able to sleep at night. And this study goes into very deep look into what people can expect in the battle against rheumatoid arthritis. It cannot be underestimated how important it is to have a balanced program for someone in this regard. In my own personal experience in the clinic, what I find is something very similar. Regardless of whether someone's taking medication or not, when I'm giving them acupuncture and herbs, or even acupuncture as a monotherapy, absent any other form of care, the patients seem to improve. And in my clinic for over 25 years, that's been the case. Sometimes I would say the improvement is what I call acceptable, meaning that they can move around, enjoy life, and not suffer. So literally, to see a patient come in and not even have the ability to get from the chair to on the treatment table and helping them up. And it's an ordeal just to get them on and off the treatment table, just lifting and helping and assisting. The inflammation, the swelling, the heat off the joints can be crippling. And then to turn around a few weeks later after some acupuncture, and I am visualizing one particular patient in my head and the results that she got. About 60 years old, female. And one day I said, "Oh, you're here for your follow-up." She just jumped right up on the table, and I just thought to myself, wow, there it is. I can take all the notes, and she can tell me how she's doing better. But just to see her get out of that chair after the brief interview, taking tongue and pulse diagnosis, checking up on symptoms, and then just jumping right up on the treatment table, lying down, "Okay, I'm ready." I just thought, yes, that is exactly what I'm talking about. Her arms were moving nicely. In the beginning, she cannot drive. Now she can drive herself to my office. I'm not saying that she's not going to need other types of medicine or that there will not be flare-ups in the future, but this is one extremely important element in their treatment. I cannot stress this enough, how important the acupuncture and also herbal medicine can be for these patients. Now, what's interesting, unlike, let's say, an athlete who comes in with a strained shoulder or maybe some minor tearing of the ACL, where we give rather robust treatments with electroacupuncture, vigorous needling techniques, things like this. For the most part, what I am seeing is that very gentle treatment at first gets better results. Way less needles, 1 or 2 or 3 acupuncture needles sometimes. Very thin gauge, very light touch, and great results. Because why? The qi is so deficient. The energy level. People say, "Oh, I don't know what qi is." I said, just think of energy level. Qi is just a word. We're describing the flow of energy. So in this case, we're saying how exhausted, how much fatigue they have. If it's very deficient, we cannot overload them with a strong treatment. It will simply be hard to accept the treatment value. And the lighter treatments have a tonifying, a toning, a strengthening property to them. Seems to work better for people who are extremely deficient, including fibromyalgia patients and rheumatoid arthritis patients who've really been in the throes of a flare-up. And that's when I tend to get the best results. I've spoken a lot with other acupuncturists on a continual basis about this. And when we go back to the ancient writings in Chinese medicine, yes, the finer gauges and the lighter styles and the Pingbu, Pingxie, the lighter stimulation techniques were recommended even in the Huangdi Neijing, one of the ancient books of Chinese medicine, for people who are either more deficient or have a lighter, less robust lifestyle. And then for people who were stronger or had thicker skin, who were farmers, had a lot of power, a lot of qi or energy behind them, let's say an athlete or a young healthy person, or someone who's older but has a pretty good diet and sleeps well, not too much anxiety, something like that. A strong person with a good reserve, or just genetically has that, then more robust treatments are appropriate. But in the case of rheumatoid arthritis, it is certainly the case that a lot of the people, the most gentle of care is needed, and they respond more strongly to the gentle care. So, seemingly paradoxical, it would seem that they would need stronger care, but it doesn't work that way with them, and they do well. And seeing the results decade after decade in my clinic, I can't stress enough how important it is for someone who suffers from rheumatoid arthritis to find an acupuncturist who specializes in this in their area, to see them on a regular basis, to really get their life back and take control. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com